So welcome to another edition of the Osteopathic Lyceum podcast. As I said previously, we've got Julia on to speak about some of the process of taking the abstract concepts and applying them in novel circumstances. So kind of the process of learning a way to do things, not necessarily every single possible detail and trying to remember it, but being in a situation where you have to change stuff. So I don't know that there's a smooth way to start this, especially based on how I did it. So a lot of it came from conversations that you had with me. You would send me messages about certain cases. Mm-hmm. And to be fair to me, I experienced them as statements. You might have felt they were questions.
Gotcha.
Is that fair?
No, I think they were more statements,
okay.
And I was looking for some feedback.
Okay.
Yeah.
And this is why the typed conversations can be tough, mm-hmm. Because no matter how you intend them, somebody reads them in a way.
Yes. Yeah. And the tone and everything else can be misconstrued.
Yeah.
Yes.
And I was not trying to, but it was just like, these are statements and you solved the problem. I don't know. I have nothing here.
Yeah.
So essentially what was happening is you were noting that there were, because one of the things that we do is we have you generate a primary approach with a set of tests for your normal assessment. Then if there is no finding there, you grab one of the ones that you've thrown out.
Yes.
Because we work everything from scratch.
Yeah.
Everything from scratch with no prior instruction about the method. It's like, okay, patient seated, active rotation of the neck, patient supine, active rotation of the neck, patient lateral, active rotation of the neck, so on and so forth, ad nauseum with all areas and all movements. Mm-hmm. So that you do it once and then it's, okay, edit the approach. How would you do, if you found a problem with the neck, mm-hmm. How would you, as quickly as possible, figure out which areas you need to zoom into? And then that guides how you make your normal assessment process. Mm-hmm. But chronically stated by me is, you will have to change this. You just have your normal one so that you have something.
Yeah.
You're going to have to change it.
Yeah.
So your commentary, if I'm getting it properly, is I had to change it a lot.
Yeah. Yeah. I think I just always think of like other people for whatever reason, mm-hmm. right? So I was able to change it.
So it's like, I'm awesome, right?
No, but like,
but I'm concerned about other people.
Yes, but I'm concerned that some people would kind of hit that bump in the mm-hmm. road and not be able to change it, because mm-hmm. it's easy to get complacent and just do the same things regardless.
Yes.
Like, I can't lift this leg, I'm going to force it. Or I can't, move this person's mm-hmm. arm, but I'm going to force it, mm-hmm. right? To check motion.
So the way that I would describe that is idea before reality. So, or idea before shared reality, it maybe is a better way to put it. So I have this idea, this is the way I do it. Mm-hmm. So like, this is what I'm going to do. I'm not going to try to change it.
Yes.
So the concern that you feel, mm-hmm. not necessarily that you observe.
Yes, I feel it.
That you feel.
Yes.
like I had a dream.
Yeah.
You can't go to that kind of deal.
Yes. Yeah.
I mean, you're a mom.
Yeah.
Like, I had a dream about this fox. That means that you can't go to the hockey game.
Yes.
Right?
Yeah.
I don't think you do that though.
No, I don't.
Okay. But you know what I'm talking about.
Yes, I know what you're
talking about. So the concern is somebody's just going to force it on and not be able to think of alternate ways.
Yes.
So the way that the program is designed is to force you to generate many alternative ways to start, mm-hmm. and then choose the ones that are most appropriate most of the time. And then the constant refrain is, you will have to do this differently. Mm-hmm. You will have to do this differently.
Yes.
How do you do it differently? Well, the things that you don't like to use, mm-hmm. it'll be one of those.
Yeah.
Right? And that's your experience.
Yes. Yeah. And generally speaking, I feel like most people, but mm-hmm. I don't know if this is accurate or not, but I would guess mm-hmm. that most people, if you like to do something and you're good at something, you just keep doing that thing.
Yeah. So
like, you won't actually open your mind to being
mm-hmm.
like, oh, like I have to think back. Mm-hmm. What did I do? Mm-hmm. In a previous circumstance. Yeah.
So the sentinel error of an expert is that they learn what not to do. Mm-hmm. So going from novice, you kind of need to know all the details. The sin is the sin of interpretation. So I feel something, but I don't know what it is or what to do.
Yeah.
Is essentially the way you would describe it, especially in hands-on. Mm-hmm. Whereas the expert learns what not to do. The problem becomes what the expert learns not to do, they throw out. And if the problem is in the thing they threw out, they won't use it. So
Yes.
that's kind of what you're pointing to.
Yes.
So it's a normal phenomenon that is easy to happen. You're right, it's easy to happen.
Yeah.
But that's actually why we go from scratch, make you do everything on your own, then provide guidance. So it's discovery learning followed by guided learning.
Yes.
And you can support me that that's what happens.
Yes. Yeah.
And then I ask you, I'm like, edit out the stuff that's stupid, right? And because you do that, the fear would be that you won't remember it, that you'll just go to the good move.
Yes.
And you do remember me saying fairly regularly, you will have your heavy hitters. You will have your preferred moves.
For sure.
But those moves are the reason that you'll have a hard time solving some things if you won't just stop.
Yes, exactly.
Right.
Yeah.
So I've said that.
Yes. And by the end of the program, it's easy to just keep going to those heavy hitters.
Yes.
Because most people in the program move relatively well, and you can test the same, and the people that you're treating day to day.
So I know that that's something that's going to happen. It's also why all 3 levels are in at the same time.
Yes.
So that you get reminded of the other things by watching them.
Yeah.
The challenge is that your drive as any individual will be to share your heavy hitter with the new person. The benefit that you should get is, wait a minute, that's cool. And I think most people do a decent job of that, as myself as the educator.
Yeah.
I think people are doing a good job of that.
I think so too. Yeah.
But I understand the fear. What I have seen that fear do to others in educational situations is essentially people are not, I'm not seeing the thing I would want to see in this group of people. Therefore, they're not smart enough to get it. So I have to overtake them and just give them a set of approaches in a particular order so that even if they're not smart enough to do the real stuff,
yes,
they'll accidentally get good results just by following this recipe.
Yes.
So I've seen that in person.
Yes. I have also seen that.
And it's because the view of the educator is I'm not seeing what I want to see. Really, what I would say based on my observation is that they didn't see the things that they liked. So they sort of decided that that approach wasn't doing what they wanted. So it's like, okay, I'm going to give you this so that you have something to work from. Now, embedded in all of these things are the core concepts. I use the term heuristic.
Yes.
They're all there.
Yeah.
But if you don't explicitly tell people, they won't know. So you also have some experience whereby you kind of get into a position that's novel, and then you're like, okay, what's the thing that would help me solve this? So you can kind of think back through some of those.
Yeah, I always think back to the heuristics. Yeah, whenever I hit a hiccup with somebody, or even if I retest and I'm like, oh, I didn't make the change that I was hoping, I always go back to those, which I actually... I mean, I did it here too, but I did find that I would use my heavy hitters here more. Especially at the end. Sure. But yeah, like now I'm using them way more.
And instead of making it sound like there's some fancy, thing that should be sparkly and
even lights, just like contact as control and like the basic things, like one thing stays still,
relational motion.
Relational motion. Like those things, just those concepts pop in your head and you work based off those concepts.
The reason that those are there is because they prime for far transfer. They are a non-tangible thing that is always there, and the details that will relate to them change.
Yes.
So it's the attempt to prime for that, because really it's a highlight of expertise. Far transfer is seen in experts. It's rarely seen in novices. But you can improve it if you provide the actual abstract thing, right? So your heuristics are the abstract concept.
Yeah.
Then you provide a minimum of 2 examples.
Okay.
I go overboard.
Yeah.
And it's like every example you could possibly imagine in every area, I make you do it from scratch.
Yes.
And then I provide the feedback, improve it. In this situation, you need to do this. It's not because that you always need to do this. It's because this thing's this size, your hand is this size.
Yeah.
Whatever. But it's always relating back to that abstract concept.
Yes. Yeah.
So my general response when you were sending those messages, making those comments, making those statements was, yeah, but you figured it out, right? And you're like, yes. And I'm like, okay, so it worked exactly the way I said it would.
Yes.
Now, but the challenge that I think I would predict in most people isn't that they do solve it. It's they have a hard time with the feelings.
Maybe, yeah. Maybe it could be just a feelings thing where people are like,
the uncertainty.
Yeah, I don't know what I'm doing.
Yeah,
and now I look like I don't know what I'm doing.
Yeah.
And now I feel like an idiot.
Yeah.
Right? And I don't like that feeling.
Often the person on the table has no idea. So
No.
if they are willing to show up, they have made the superficial gesture that they think you have some kind of authority. Right? You will panic inside. You've heard of imposter syndrome?
Yes, I have heard of that. Yeah.
Right. So imposter syndrome, you've heard of the Dunning-Kruger effect?
No.
You ever heard you're too stupid to know you're stupid?
No, I've never heard
Not directed at you, but have you heard
Thanks, Sam.
No. Because I'm going somewhere with no. It's so the Dunning-Kruger effect is essentially a curve where if you plot confidence versus, say, actual knowledge or skill, people with low knowledge or skill overestimate their knowledge and skill, where people with high knowledge and skill tend to underestimate. So that's kind of the imposter syndrome.
Yes, yeah.
So usually when people are talking about the Dunning-Kruger effect, it's just you're too stupid to know you're stupid, right? So,
and I will cut you off here, and some practitioners I've seen, not osteos, but even other people, have like crazy confidence. Like the confidence is like out the window. You would think they were like the smartest people on earth and they know everything. If
you judged it on that.
Yes, if you judged it off of that. But then, say if you're treated by them, you don't always get results, and you're like, "Well, you're very confident in what you're doing," and she sees a bunch of people, and or he, and so it is interesting.
Yes. I try to talk about that as respectfully as I can. A high degree of certainty with a low observable outcomes would be an example of the Dunning-Kruger effect.
Gotcha.
Now, genuinely, the people that are doing that don't know different.
Yeah.
They are convinced that they are doing the work of the universe.
Yes.
They're connected to it. And
no, I can see that.
It's quantum physics.
Yeah.
In case you didn't know. So...
and I see it even in our classes, like with the students. Like there's some students that have a ton of confidence and just like...
Oh, but that's going to be anywhere.
Yes, but there's also students that I think should have more confidence that don't yet.
Yes.
Right?
And that's a normal distribution. So you don't need to intervene with that a ton. The intervention there is to consistently point out when the person with low confidence is doing a good job.
Yes.
So say yourself as a student, I don't like it.
Yeah.
I don't like it.
Yeah.
I don't even know if I'm doing anything.
Yeah.
Right? And I was like, every time you would do something, I'm like, that worked. Like, whatever.
Yeah. You're in
you
denial.
Were you were firmly dismissive of that. But then what happened for myself in observing how you were interacting with stuff is I saw that you heard that you stopped saying, I don't like it. And then you would start giving feedback to people that was perfectly in line with what my aim was.
Yeah.
Right. Or what I think the aim of the profession should be, because it's highly variable individual to individual, but the goals are the same.
Yes.
Find what doesn't move it. It sounds like an oversimplification, but because it is an abstract framework, you can carry it into any situation and figure out the details. Right. The one that I don't talk about a ton is PTB, patient activity, active or passive, tissues targeted. The answer is always the ones that don't move. Right. And then barrier, direct, indirect, or no choice.
Yes.
Right. So if they say ouch, go indirect. If they don't say ouch, you can go direct. It's fine. Just don't go so fast or so far that they say ouch.
Yeah.
Right. And ouch is protective mechanism.
Yes. Yeah.
Right. But that allows you to make really, really straightforward choices. It's always there. So when I start hearing you give feedback to others about that exact stuff and showing them technical details that I'm like, yeah, that's exactly what you would want to see. I'm like, oh, you're fine.
Yeah.
Right. As opposed to, using like a positivity sandwich. Have you heard of that one?
No.
You're going to give somebody critical feedback. What you do is you give them a compliment, the critical feedback, and a compliment.
Oh, yes. I do that with my son all the time. Yeah. Tell him something good.
Yeah.
Tell him something bad, then squish something good in there too.
Yeah. Is it when you give him the more critical feedback? Is he like this? And then he goes...
No, he's pretty good with he's pretty good with it.
Okay.
I don't even have to do it. Sometimes I can just do the bad stuff.
I'm actually surprised because it seems like with the teammates that you just tell them that they're not good.
Yeah.
At least with what you've told me. I don't know. So yeah, but you can, if you see where somebody's having trouble, sometimes if you shine a heavy spotlight on it, it burns.
Yes.
obviously this is more of a metaphor, but
Yes,
sometimes
yeah.
if you move the light around, they can follow.
Yeah, I know,
right?
I understand.
Like it's more of a metaphor, but it's essentially identifying the technical deficit or the cognitive deficit and working with it in a way that is not overwhelming.
Yeah.
Right now, based on my sense of humor, right, and the variable individuals in any given room, you'll see that I talk to different people differently. Right? I have a performative style when I teach.
Yeah.
Right? So there's two things that have actually happened. I was kind of joking around and I said something about somebody being dramatic, and I'm like, yeah, like I'm not dramatic, and somebody's response was like, well, I'm like, whoa, like nobody in my life has ever called me dramatic.
Called you dramatic,
like nobody ever. So we need to talk about this. So we talked about it, and it was the way they were using the term, and I'm like, okay. I'm like, well, if I'm delivering a performance to a room, there will be something like that. And then somebody else or saying something about somebody being high strung. It's like, yeah, like I'm totally not high strung. And they went, well, like, whoa. You've seen The Princess Bride, right?
Yes.
My response to those two things was like, I do not think that word means what you think that it means. Like it's not inconceivable. Yeah. So I was like, whoa. So I think what I'm learning as a result of those two small interactions is like what you're seeing of me as a person in a classroom is more so that I'm providing some level of performance to a room because I need to manage engagement.
Yes.
Right.
Yeah.
If I'm boring and I'm just like, so this vein.
Yeah.
It's like,
yeah.
you know, or I give some traffic analogy or whatever.
Yes.
Right.
Sure. Love the traffic analogy.
So whatever. See.
Yeah.
If I do that, then I can't manage the engagement. I've got to work a room. So when you're working a room, often the person that you can get kind of the most connection from or the most engagement from helps bring the room around.
Yes.
Obviously, people will detach it at different times. You can't fix that. But because I'm doing that, they see that sliver of me where nobody else sees that sliver of me. So I'm like, oh.
Yeah.
So I'm actually learning something about that and how I can be viewed as a result of that. And I'm like, oh, that's weird. Cool.
Because you're not used to hearing that.
Not at all.
No.
And I'm like, and I'm definitely not high strung.
Yeah.
But I have a strong sense of humor.
Yes.
So what it was is the intensity that I'll bring, especially around accuracy.
Yes.
My family's always had a problem because they can't get me excited about anything. I'm like, okay.
Yeah.
Right. However, when there's issues with accuracy that I think I sense, I work on it. Because I work on it pretty directly. So if somebody says something, I'm like, hold on, I've never heard that before. I need you to help me. Yeah. It can sound like I'm attacking, and I'm not. I'm like, dude, just right now. Yeah. I don't know about that. I need you to help me. So there's an intensity that people can experience with that. I'm like, okay, I get what you mean. Right. I've also been told that when people share something they're excited, I'm often negative. And I'm like, okay. So I get the chance to take this in because I get the feedback, and it's an important thing about learning. So we talk about this and relate it to some degree to what we're talking about with working on the table in novel circumstances. If there's a new piece of information that you haven't dealt with before, well, how do you deal with it? Okay, what's the aim? What am I trying to do? Yes. I'm trying to move this thing. Okay, what's the aim with a new piece of feedback that I've never heard about myself? I'm like, okay, what do you mean by this? Yeah. What can I do about this? Is this something I need to do something about? Like there's it's still an abstract framework. It's the same framework, but applied to a very different circumstance. So to gain that feedback helps me learn where other people might have a challenge. And all of that then goes into the educational role, whereby you have to try to figure out what the issue is for the individual learner. Guess what that sounds like? The osteopathic profession. Yes. I don't have to figure out what the move for the neck is. I need to figure out what that neck needs. Yeah. How do I figure out what that neck needs? Well, I need to make a bunch of moves for the neck. And then based on having done that, I then choose the ones that I prefer the most. And when those don't work, I just use one of the other ones. Yes. Yeah. Right. Are you finding that you transition quicker between barrier approaches than you would have before? Yeah. You don't hammer away when it's not giving you anything. You just change. You're like, I'm done
I can
with that.
usually tell now, and I mean, I haven't been practicing that long. I can tell pretty much right away if somebody doesn't like something. Yeah. Yeah. Like if
it's not hard.
Yeah. If I'm going direct and they're giving me any sign of I don't like this, I go right to indirect first, see how it goes. Sometimes that's all they need. Sometimes I can then go to direct after, and they're a little bit more calm.
With most of the bodies you experienced in education, although it was the same people often, you could tell really quickly when they didn't like it.
Yes.
Right?
Yeah,
So,
but I think in the educational setting.
So hold on. Give me 1 second to go somewhere with this. The problems that you would find with them were more subtle. Is that fair?
Yeah, more subtle.
Is it easier or harder to find a subtle problem?
Like, I don't know. Honestly, it depends.
That's a fair answer.
Yeah.
But if, say, the motions that you're testing are generally good, but there's a small problem.
Yeah.
Is that easier or harder to find than the big problem?
It's harder to find.
So my argument would be, because it's more subtle and because you've checked the same people many, many times, it can lull you into a sense of, I already know.
Yes. Yeah.
Which is why I'm like, ha ha ha.
Yeah.
Go ahead and actually find it.
Yes.
Right?
Yeah.
So I know what you're saying. Right? Because it's like, well, the person who's really messed up, it's, I don't necessarily see that a ton because you can't guarantee that you will through an educational process.
Yeah.
But when somebody's really messed up, how hard is it to find out what they don't like?
Oh, it's easy.
Yes.
Because they don't like anything. Like they're in pain and they're uncomfortable.
It's harder to find what they do like.
Yeah.
But because you've done it with subtle things, you just switch.
You can switch it faster.
Really fast.
Yeah.
So
I do find with the something subtle, sometimes I find just with just yield to pressure, soft tissue assessment, I can find something very quickly. Like even just with my hand, like a broad hand.
Like that.
Yeah.
And that didn't take long in a technical sense to develop. It maybe took a while to trust.
Yeah.
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 Which is normal. So the novice senses everything. The novice's hands are awake.
Yeah.
They just don't trust.
Yes.
As you go along, you trust.
Yeah.
And you're like, it's right there.
Yeah.
This isn't hard. And in your experience so far with seeing newer levels of students come in, is it hard for them to figure it out?
The new group seems like they figure things out.
The newest group. More so I'm talking about the consistent phenomenon where once we have all 3 levels present, it's just so much faster.
Yeah, because they're feeding off each other.
Exactly.
So the level 1s are in the first month. By the first month, I think they gain feedback from the upper years, and then they're able to kind of sponge that.
Yes. So it's a more rich feedback environment.
Yeah.
On purpose. So right now I feel like, man, am I a used car salesman right now? I feel so
sales
sleazy.
pitchy.
Yeah.
No, but it is like, I think it's just like, for me, I think the way your school's set up and everything is good.
Your school too.
In that sense. But I do think that there's always going to be people that want I want an orthopedic test, for example, a treatment for that, and it should be the same on every person.
But it won't be, so good luck.
But so many professions run like that. Like that's the way they educate.
And that's, so the actual, the legitimate place where osteopathy is different than other hands-on professions is the barrier concept.
Yes.
That's the place.
Yes.
Whether most osteopathic practitioners are able to explicitly say that or not, that's the difference. They will say it's that osteopathy is a philosophy. And I'm like, you don't know what that means, and you're not that smart, right? Because it's thinking without evidence, and it's what you consider a valid conclusion without evidence. Well, that doesn't exist because human being.
Yeah.
But the other thing is that osteopathy is broadly good because of the barrier concept and its extension at tuning into the person and the what I call the performative nature of stuff, whereby I'll joke and say I think they need a cape.
Yes.
With rhinestones.
Yeah.
That it's look at this, woo! So we work here and look at the release over there. That kind of performance.
Yeah.
Which you haven't seen much of.
No, I haven't experienced that a ton. I have heard of these stories.
Yes, but you haven't experienced.
But I haven't. Yeah,
well,
I
I've
haven't
seen
experienced.
it.
Yeah.
I spot it right away.
Yeah.
There are specific people who I think are good practitioners, and they are using the methods that they were taught with to teach. It's a show.
Yeah.
And I get it. It's not my favorite, but I get it.
Yeah.
So I'm not mad. I'm like, that's what that is.
Yeah.
You need a cape.
Yeah.
Possibly with a battery. So even then, with those showy things, what they're doing is they're talking about tuning into subtlety.
Yeah, but I think a lot of the profession itself is tuning into subtlety.
That's all it is.
That's what I'm saying.
Yeah.
So if I have patients that talk a lot, I find it harder to tune into what their body's telling me.
For now.
Yes.
For
so
now.
that I think will come with time. but I do feel like I have to ignore people. Sometimes I miss half a story.
Oh yeah.
Because I'll be like, what is she talking about?
Yeah. So one of the ways I've seen people deal with that is like, just hold on for 1 second. Hold that thought. I just need to pay attention.
Yes. Yeah.
Now, if you do it that way, you're a type of practitioner. You're like, just hold on a second. I want to listen, but I need to pay attention to this. So there's different levels, say, of firmness that you can do.
Yeah.
But yeah, because of them trying to show how sensitive they are, you actually end up by accident getting better able to tune in. The problem becomes how you interpret that cognitively.
Yes.
Right. Yeah. And obviously, if you hang around me and the approach that I take, I don't speak particularly positively of that. I try to say, listen, go to the place where you're making as few assumptions as possible and explaining as much as you can. Is why I focus on the movement more than the specified structures that you can't see.
Yes.
It doesn't mean those things aren't happening. It just means that you're going to mess your brain up, right? I tend to say, and I say it to classes, thinking is a dangerous sport. It's not that you don't have to do it. It's that you should do it as little as possible, but as much as necessary.
Yeah.
That's a new extension.
Fair, yeah.
I hope that works. And if it doesn't, I'll throw it out, whatever.
Yeah.
But overall, because one of the things that you did note when we talked about this is that when you're in that novel situation trying to figure something out, you're not panicking.
No.
Your concern is somebody else. Initially, when you didn't know what to do, did you feel a little bit of stress and did that go away? Or did you always be like, No,
so initially what I would do is always just go back to like what I knew.
Yep.
Versus like thinking of what else can I do. So like I think your initial response when I first started in school in general was just do what they told me to do and I'm going to do it and just keep repeating it. And eventually I'll figure out the rest.
Yeah.
Right? But like as you're going through and working on people and you have to modify things, I don't panic. Like I don't think I panicked when I was a student either.
Yeah.
But I think I just kind of would go with what I knew.
Yeah.
Whereas now I'm a little bit more like...
You're willing to try.
Yeah, I'm willing to try something. Yeah.
So at least as a single point of observation, this is all exactly as planned.
Yeah, like I use a lot of I use the heuristics all the time, but I don't do the same moves that we did in class almost ever.
And that's the point.
Yeah, like that's once in a while, but not really. Like sometimes I do other things.
So when we say the moves that we did in class, there are things that I will show based on what we're doing. Yeah. But it's not that those are the only things because you did so many other things that weren't at my direction. The other deal is that, do you remember sometimes where I would do something, I'm like, I've literally never done this before in my life.
Yeah. No,
like
I
literally.
Remember. Yeah.
And then there was times when people, and I say this to a lot of individuals who are interested in the school, if somebody in the room does something that I never would have thought of, I'm like, I literally would have never thought of that. Yeah. And I ask them are you comfortable being filmed doing this? If they say yes, I do it. And you can find those videos. Yeah. If they say no, I say, this person was doing this and I'll show it. Yeah. Because I want them to get credit. I want it to be clear that sometimes the level 1 comes up with the coolest stuff.
Oh, for sure.
And in your experience, the people who come up with the coolest stuff are the level 1s.
Yeah. No, a lot of them do. Yeah.
Because it is actually novel and they're trying to solve. So they have more access to creativity. Yeah. They're less in a situation where they're learning what not to do, what works most effective. So they contribute the most to the broadness of approach. Yeah. Which is sort of what I expected. Whereas a level 3 will contribute most to the effectiveness. Right? So it's a good balance to have at the same time. Yeah. And as I've been going through and as I test the level 1s, one of the things that's happened as all 3 levels are present is the level 1 test scores are better faster. And I'm like, it's not what I wanted. It's what I'm getting, which is the good thing. Yeah. But I sort of wanted to display, and this is more on a testing validity kind of deal, where you want the score arc to look a certain way because it's more statistically valid. And I'm like, well, that assumes that there are standard things that you'll see in the group. Yeah. Where if the dynamic of the group changes and the feedback is getting better, then it would I should assume that I'll see better scores based on the standard marking approach that I use. Yeah. Right. So it's like, didn't want to see this, but here it is. Yeah. It's like a good thing. But if people look over the shoulder of the school at the test scores and the arc of progression, they won't see the same thing. So they'll think, well, what did you do? I'm like, they got better. That's what we did.
Yeah. Yeah, for sure.
They got better faster. And that's so
But you might have a group that comes in that it's it doesn't really work. Like you might have an anomaly in there. Who knows?
My feelings and my personality right now will say, I don't think so.
Yeah.
Because everybody has to talk to me.
But it might happen.
It's not impossible.
You never know.
You're correct. I am accepting that it is possible.
Yeah.
But I'm also saying that there is actually something happening, because over time you'll always build a culture. You want to be careful in how that happens, that it doesn't get stuck on a thing.
Yes.
Because the hope, you weren't here this morning, one of the things I said is like, listen, if you have an argument that is different than my approach, I would rather hear it so that I can learn from it, even if I disagree with it.
Yeah.
Right. And I said, my feelings want me to be the most right.
Yeah.
But that's why I should hear what somebody else has to say. Now, there are times when I've heard it before, and I'm going to be really dismissive and really judgmental and really fast.
Yeah.
But it doesn't mean that I should be that way. So that's me saying in a roundabout way with lots of words. Yes, your point is well taken. That can change, but over time, based on the process of admission, I don't know that it will. I think it will go in the continued direction, and other people having a positive experience will transmit the positive experience. So I think that's the way it'll go, because it's more about, I'm free to learn. I'm free to make errors. When I make errors, I get feedback. I get better. And nobody's jumping down my throat, metaphorically speaking, or purposely adding stress. Like I have enough stress on my own.
Yeah, for sure.
And you're relatively well supported. And the environment is generally light.
Yeah, it's light. And I think the support is actually outside of here, because I know they have like a student chat.
Yeah.
Which is actually super helpful, because I see it still.
Yeah. I will never look at it, ever.
Nothing said about you, but I will say.
No. The reason I say that is because I don't want to change whatever that is.
Yeah, that's good, because I think there's a lot of good communication in there, and I don't contribute to it anymore. Like I just I still have access to it because I was a student here.
Yeah.
So but a lot of the bouncing questions off each other is important.
Yes, which is normal
and it's
behavior.
all the levels in there, so that you're getting level 1s asking level 3s, level 3s asking level 2s. It's the same
normal behavior.
Yeah.
Self-generated. I didn't tell anybody to do it.
No.
You guys did it on your own.
Yeah.
And I'm assuming, are nice to each other.
Yeah, no, they're all good in there. And I think for some people that they practice different modalities, I will say.
Well, they have backgrounds.
They have backgrounds. So like,
that's why we're at Type 2
if
school.
somebody needs if somebody needs somebody that does FST, like they'll just ask on there, like, does anyone know anyone that does FST? And they'll be like, in this area, that's this person. And even just for networking, it's really, really good.
Yes, because it's a self-generated thing, it has the ability to have that positivity.
Yeah.
If somebody tells you to do it, it's a chore.
It's work. Yeah.
Yeah. So when it's self-generated and nobody is in there attempting to make it one thing or the other, it works pretty good. Because the term would be it's bottom up.
Yeah.
Right. It's grassroots. Right. So just like I will generally avoid any reading of commentary, the thing, and you've heard me say this, I will have the reputation I earn. And I'll leave it at that.
Yeah.
Because there's enough things in life that can make it hard to sleep.
Yeah.
Right.
Yeah. You don't need any more.
Why would I listen to somebody who doesn't know me talk about me? So I joke and I say, like, if you're going to give me advice or insult me, at least take me out to dinner first.
Yeah. Yeah.
I'd like your insults or your advice to be about me.
Yeah.
I'm used to being personal. Because of where I grew up.
Yeah.
And the time I grew up. Yeah. Anything else that you currently think is valuable to add? And now in asking that, I recognize that sometimes it's just like in the moment, like, I don't know.
Yeah, no, I think we covered everything that we chatted about.
Yeah.
For sure. Yeah. I was just thinking it's so easy to be complacent and just robotically go and parrot things.
Absolutely.
And you kind of see it happen to some people on and off.
Absolutely.
You
But they're capable.
Yeah, for sure.
So the whole deal is they go through the process, create stuff from scratch. So they can. Then they will have their heavy hitters. That is the normal thing with respect to moving from novice to expert. So they'll stay there, and it is easy to get complacent. But the moment they realize that it's not working, I know for sure, because I've seen them do it more than once, that they can do the other stuff.
Yes.
I know it for sure. I have no questions. Right. And that's why we test people every time, because I get to watch exactly what you do. And I can give you the feedback on the errors you are making. And if you're not making any errors, I'm like, okay, well, that's working.
Yeah.
And then as I walk through the room, I'm assuming that there's certain times where it will surprise you what I pick up on. And then I'll be like, no, like this.
Yeah.
Right. Sometimes it's surprising. If you know what you're looking at, you see it right away. If you have a simple framework, or maybe not a simple, but a straightforward, clear framework to connect things to or to observe against, it's like, yeah, no, you're pushing too hard. Well, how do you know? Well, their pelvis is rolling and you're trying to move their ribs.
Yeah, it's too much other movements.
Yeah.
Yeah.
Contact is control. Table makes stable.
Yes.
Right?
Yeah.
It all sews together relatively well. So it seems like it's working. You're evidence of that.
Yes.
So, and that's one of the reasons I ask also in conversation. I'm like, hold on, these sound like statements.
Yeah, I think I was asking, the way I asked the question
It's
was like, this is what I did.
So this lady with a neck.
Yeah, but I almost wanted you to be like, have you tried this?
Yeah. But what
or like,
because
that's good, but did you do this? Or that's not good, but try this, right? Like, give me another option. But then you were like, nope, you're good.
Yeah. So it's
like, what the hell, Sam?
So it's nice that you're saying this to me.
Yes.
So that I have some understanding when you engage in that behavior, that you're looking for feedback. Yeah. And what I'll say is that type of communication wouldn't give me the drive to say, well, have you tried this?
Yes.
It wouldn't do it.
Yeah.
So it's not a you thing. It's not a me thing. It's how that communication works. But because you were very clear in what you had tried and it changed, I was like, yeah, that's good.
Yeah.
That's exactly what I would want. Right? That's exactly what I think would be positive.
Yeah. I think it's easy though when you're try something, say new-ish, or something that you've done or done a variation of it, but not exactly like that, to kind of doubt.
100%.
Yeah, like the doubt comes in your mind and you're like, but it worked, so I guess it's okay.
So when I say, if it works or it doesn't work, you'll figure it out really fast.
Yes.
Because you just go back to the initial test.
Yeah.
And it's either better or it's not.
Yes.
So you get feedback right away.
Yeah.
I need to make sure that you understand that that's the main feedback mechanism, because nobody else will be there. Right? So once you figure that out and you're like, nope, it didn't work. You're like, okay, I'll try something different. If it did work, you're like, it worked. But you can still have that feeling like, was it right?
Yes.
It's like, well, it doesn't matter. It worked.
Yeah. Yeah.
Because the best way to put it is you will usually be mostly right. You'll never be sure if you're completely right.
Yeah.
It's just not an option.
Yes. Yeah. Yeah.
Based on how our cognition and our experience of reality works. But you'll be pretty darn confident that's different. And you have to be honest with how you test.
Yeah.
And we work on that all the time.
Yeah. You have to test the same way that you
But
retest.
even then, it's a lot of the feedback I'll give is like, yeah, that was a little different. You didn't do it. So just to try to make sure.
You can easily shortchange a test.
Exactly. And it happens often, does it not?
Yeah.
Especially in your experience with other hands-on practitioners.
Yes. Yeah. Or they just don't retest.
Yeah.
Yeah.
Yeah. And you've experienced multiple hands-on professions.
Yeah.
That don't really retest.
No, none of them.
They just do the move and like, we're done.
Yeah.
Like, how do you know?
Yeah.
I feel like trash and I don't move better. I think I move worse. So when you're around the people in the school, if it changed, you all agree it changed.
Yeah, for sure. And I think if it doesn't change, there's other ways you can attack it.
And then you get that feedback right away.
Yeah.
Yay.
Yeah. Good job, Sam. This video is about tapping Sam on the back. Good job.
Yeah.
That's why you wanted me to stay later.
No. No, I'm just taking the chance.
So I'm amazing.
Yeah. I know, right? I'm fantastic. Now, the humor with that, because it can easily get there.
Yes.
But the willingness to recheck and see if it worked has large value, and it becomes very clear what you need to change.
Yeah. Also for the patient.
Yeah, absolutely.
Because the patient knows what they feel, and sometimes they're like, "I'm still sore here," but they're moving way better, and they know that they're moving way better. Yeah, and that's like the most important thing.
Yep. Yeah. So it's literally all by design, and all of the things that you've provided commentary about, I'm like, oh no, I thought about that. Right? Like I got ahead of that because I happen to have learned more about how to set up educational settings.
Yeah.
Right? No, I did it on purpose, and it worked. Right? But that feeling, the experience of that feeling of like, I don't know, was that the right thing?
Yeah.
I know exactly what you're talking about because it happened to me.
Mm-hmm.
Right? And with being on your own and trying to figure it out. So because I did that, because I felt that, I've designed with that in mind.
Yeah.
On purpose. So it's probably going to happen to others.
Oh,
so it's
for
good
sure.
that this conversation exists. Whether you goddamn bastards will watch it or not, I don't know.
One person will watch it.
Also, how many water bottles did you see?
Lots.
In weird places this time.
Weird places.
Weird places. The goddamn water bottles.
Yeah, you half-used water bottles.
Yes.
Yeah.
Okay, so thank you for watching this far. Hopefully you learned something from that. And thank you, Julia.
No problem.
What we're going to do is you and I, after I turn this off, and I'm saying this here, is we're going to film the fucking water bottles.
Okay.
All right, sweet.
Let's do it.
Yeah.